Thank you for having me. I'm thrilled to present the results of the STELLAR-303 study, which I presented at the ESMO Congress, and we published the results simultaneously at the Lancet. The STELLAR-303 trial is the first immunotherapy-based phase 3 trial to show significant survival advantage in patients with chemorefractory, metastatic or advanced stage colorectal cancer that are not MSI high or mismatch repair deficient, which represents 95% of the cases. Zanzalintinib is a differentiated multi-tyrosine kinase inhibitor that targets multiple kinases, including the TAM kinases, as well as MET and VEGF receptor. In preclinical studies, Zanzalintinib have shown synergy when combined with immune checkpoint inhibitors that have led to exploration of Zanzalintinib in combination with immune checkpoint inhibitors in early phase clinical trial. I have developed an early phase trial exploring the combination of an earlier generation multi-tyrosine kinase inhibitor called cabozantinib, which has an overlapping tyrosine targets with Zanzalintinib, and we combine it with an immune checkpoint inhibitor in the CAMILLA trial. And in that study, we have shown promising signal in patients with chemorefractory metastatic colorectal cancer. So that, in addition to the findings from the phase 1 STELLAR-001 study that combines Zanzalintinib with Atezolizumab versus Zanzalintinib alone, we have shown also promising signal favoring the combination as opposed to Zanzalintinib alone in patients with chemorefractory colorectal cancer. So this evidence have provided the ground to launch the phase 3 STELLAR-303 study. In this phase 3 trial, the population that enrolled on STELLAR-303 were metastatic colorectal cancer patients who progressed on 2 prior lines of chemotherapy and have tumors that are not MSI high and not mismatch repair deficient. Patients were randomized 1-to-1 to either receive Zanzalintinib plus Atezolizumab or Regorafenib dose that the regulatory approved labeling. Stratification factors we used in the study were geographic region, presence or absence of RAS mutation and mutations, and presence or absence of liver metastasis. The study has dual primary endpoint of overall survival in patients with in the intention to treat population, as well as overall survival in patients who do not have liver metastasis. The results I presented are on a planned overall survival and the intention to treat population. And I also presented interim analysis of overall survival in patients without liver metastasis. The trial continues to the final overall survival in patients without liver metastasis. As far as the efficacy, STELLAR-303 met its primary endpoint of overall survival in the intention to treat population. We have shown significant survival advantage with the combination as opposed to Regorafenib with a stratified hazard ratio of 0.80, which translates into a 20% reduction in the risk of death in patients receiving the combination as opposed to patients receiving Regorafenib. We have, with a p-value of 0.0045, the patients receiving the combination had a median overall survival of 10.9 months as opposed to 9.4 months with Regorafenib. We have seen an early separation of the Kaplan-Meier curves that remain consistently separated, favoring the combination thereafter. The 24 months overall survival estimates were 20% with the combination as opposed to 10% with Regorafenib. As far as the interim overall survival analysis in the patients without liver metastasis, we have shown a stratified hazard ratio of 0.79, favoring the combination with a median overall survival of 15.9 months with the combination as opposed to 12.8 months with Regorafenib. As far as the running a forest plot looking at subgroup analysis of key subgroups, we have seen consistent relative benefit favoring the combination in all of those key subgroups. So the benefit seen regardless of presence or absence of liver metastasis, regardless of presence or absence of RAS mutations. And also a key point to highlight is that prior exposure to VEGF-targeted therapy, which represented around 80% of the population of the study, did not diminish the benefit of the combination of atezolizumab plus zanzalintinib. So as far as the safety profile for the combination, most of the treatment-related adverse events seen were grade 1 to 3, and mostly are hypertension, diarrhea, nausea, fatigue, and loss of appetite. Of note, the grade 3 and all grade PPE or hand-foot syndrome were much lower with the combination as opposed to regorafenib, and that's despite longer median duration on treatment with the combination as opposed to regorafenib. And then another point to highlight is that we have not seen any new safety signal. The overall safety profile is consistent with the safety profile of similar combinations of VEGF multi-tyrosine kinase inhibitor in combination with immune checkpoint inhibitor that's available in other tumor types like renal cell carcinoma. So overall, I would like to highlight that metastatic colorectal cancer is considered a major global disease challenge, with 150,000 cases are expected to be newly diagnosed every year in the US alone, and a 5-year overall survival of around 15 to 16%. And so the success of STELLAR-303 study with the synergistic combination combining a novel targeted agent, zanzalintinib, with immune checkpoint inhibitor is potentially changing this trajectory. We are now looking at data analysis from the ongoing STELLAR-303 study, particularly the final overall survival in the subgroup of patients without liver metastasis. We're also looking at exploring the next generation of clinical trials that could be developed to capitalize on the results seen with the STELLAR-303, including potentially exploring the combination in earlier line setting of in patients with metastatic colorectal cancer, and potentially exploring it in earlier stages of the disease as well, in the potentially neoadjuvant or adjuvant settings. And then possibly looking at novel immune modulators that could be added to the doublet to capitalize on the results. So overall, as a key take-home message, I would like to say that the STELLAR-303 study results are sending a clear message of progress and possibility. It opens a new era of immunotherapy-based chemotherapy-free combinations in patients with colorectal cancer that are not MSI high and not mismatch repair deficient.